Baby movements during pregnancy. This is a common question that any pregnant woman would ask her obstetrician. Let's talk about it today. So, when does the baby actually start to move? When we do an ultrasound scan, anyway from 9 to 10 weeks, we can actually see the baby moving at that time itself. But we don't expect any pregnant women to perceive the baby's movements in the first 3 months of pregnancy because the baby is very, very small and the women would not be able to feel the impact of the movements. So the first movement that any woman feels can be very, very exciting, and it's called quickening. For a first-time pregnant woman, quickening is felt anywhere between 20 to 22 weeks. But during subsequent pregnancies, the women tend to feel the movements earlier, say somewhere between 18 weeks or sometimes even as early as 16 weeks onwards. When women come for their 5th month scan, that is around 20 weeks, we expect the baby to weigh somewhere between 300 to 400 grams. So the baby movements at that time is felt like a flutter or just a bubble. Okay. As the baby starts to gain weight, then the movements become more intense and it can be perceived much better. So doctors generally recommend the women to keep an eye on the baby movements from the 3rd trimester, that is after 28 weeks. The baby weighs anywhere between 1 to 1.2 kilos at around 28 weeks. So the impact of the movements can be felt better at that time. So many factors can affect the baby's movements. For example, if the woman's placenta is anterior, that is, if it is attached to the front wall of the uterus, then the women might not be able to perceive the baby's movements that well. Similarly, if the back of the baby faces the front surface of the mother, then the limbs would be in the back of the mother, so the mother may not be able to perceive the movements well again. Okay? There are different types of baby movements, like flutters, kicks, swishes, or rolls, and it varies, even in the same thing. Each woman has her own pattern of baby movements, which is unique, which she alone knows. If there is any variation in that pattern, then it is advisable to report to a doctor.